Hello, my name is Nicola Kier. So I am doing Unit 2 Journal. So the first question says, discuss a patient interaction in which there was transference, countertransference, prejudice, bias, or judgments that I have been making about the patients or they were verbalizing to me. So I have said this before in my past clinical rotations, but I have a 10-year-old daughter, and for some reason, any time, my past rotations that weren't children and adolescents, I still had difficulty, trying not to have judgment with, patients that perhaps could be the aggressor to an innocent child, or that would definitely be judgment that I had to work through. And then I couldn't help but, feel a certain way in one of my rotations that was substance abuse, and the young woman and young men that have experienced some sort of childhood trauma. And I just kept picturing my daughter and that person's shoes, and listening to what they went through, and it's like, oh my goodness, that could be my daughter, and I can't imagine how someone could do that to someone. So I really had to work through that to be effective and provide the best possible outcome for the patient. And I guess the same here in the children and adolescent rotation that I have started. These children that are that I am, with my preceptor, a lot of them have come from broken families. They have low social economic status. There's a lot of odds against them, and it's rewarding, but it's also so disheartening to see that these poor children get they're born into such hard circumstances that really truly make it hard for them to come out of. So again, I have encountered this before. Anything related to children, just because I have a 10-year-old, and my heart hurts for these individuals that have to go through certain things, and just constantly think, put my daughter in those shoes and how terrible it would be. Would I appropriately be able to continue care? So, I think what had helped me was continued practice and working through these issues that, could potentially hinder my ability to provide good care and, give, an unbiased, unjudged, sounding advice and support and treatment. I definitely had to work through it, and I can honestly say, I still get certain feelings that I have to continue to work through. But again, I think constant practice makes perfect, and that's what I intend on doing. So I think just constantly processing it with my preceptor, and just learning how to navigate through certain circumstances and cases that may be a trigger in some regard to myself is definitely a work in progress, which I plan on continuing practicing. Thank you.